So my name is Professor Johnny Moore and I'm the Medical Director of Cathedral Eye Clinic here in Belfast.
My name's Mr. Niraj Mandal. I'm a consultant ophthalmic surgeon here at Cathedral Eye Clinic.
So Niraj, you've been working at Cathedral Eye Clinic for some time now, and as you know, we're the only clinic still that has SMILE technology, SMILE laser technology. How have you found carrying out SMILE cases? Because in the past you had worked on LASIK, etc. But what's your feeling about SMILE surgery?
So SMILE refractive surgery, as I explained to patients, is somewhat of a major evolution from LASIK surgery, sometimes referred to as keyhole refractive surgery, where we form a lenticule in your cornea and remove that tissue via a small tunnel incision.
What does that do? You say you remove something, and what happens then?
So it's all done under one laser, something called a femtosecond laser, and as I mentioned, according to the patient's prescription, a certain lenticule or disc of tissue is formed in the cornea, a little bit deeper down than standard LASIK, and then that disc or lenticle of tissue is simply removed or pulled out of the cornea via a 2mm incision.
And what does that do?
So the main benefits of this, so first of all, it corrects the patient's prescription. And then the main benefits of this are, it leaves your cornea stronger biomechanically, so you have a more stable prescription. There's been shown to be a less incidence of dry eye associated problems. There's a very fast recovery, typically 1 to 3 days. And essentially it leaves the patient without a flap, and with a quick recovery, this allows them to get back to very active lifestyles, in particular contact sports, within a matter of days.
So let me ask you, I used to play rugby, and I have friends who practice martial arts and boxers. What if someone like that, obviously I'm long past those days, but what if I was still doing that and I came to you for treatment? What would you say to me? How long would it take me to get back?
So, I certainly would recommend SMILE surgery to you as opposed to a flap-based surgery. The main reason being, with a flap present on your cornea, there's always, although a small risk, a risk of that being subject to trauma, such as in rugby or martial arts. But if you were to undergo the SMILE procedure, we can usually get you safely back into practice or your active lifestyle or your sport within a few days.
Okay, well, that's excellent. So Niraj, who would be an ideal patient to have SMILE surgery on?
Well, to answer that question, recently we just treated a professional boxer who underwent successful SMILE surgery, made a very fast recovery, was actually back to sparring within 40 hours.
Yeah, well, that's quite remarkable for someone who's boxing and their eyes are potentially being hit regularly.
He had a very substantially large prescription, so being able to box and spar without the need for glasses, goggles or contact lenses certainly made a big impact on his life, yeah.
So can you explain to me what SMILE surgery is, its advantages and who it's applicable for?
So SMILE refractive surgery is a laser procedure that's carried out in about 26 seconds that involves the formation of a keyhole incision that reshapes the cornea. Okay. It's in particular very useful for patients who want to get back to their day-to-day activities very quickly, and in particular for patients who are involved in contact sports or activities that can involve potential injury or trauma to the eye.